Going to be quite a long one, so I apologise. I'll try and get through as quick as I can. But we're going to be talking about sacroiliac joint dysfunction and its sort of relationship with extension-related back pain. So it's not with extension-related back pain. There's not always SIJ problems, but quite often there is. So whenever I talk about anything to do with injury, one of the very first things you want to try to get out of your head is that you don't want to just treat symptoms. You want to try to look for the reason that you got the pain, and instead of just trying to remove the pain, try to find out why it was there in the first place. And that means you can't sort of use a template or have a one-size-fits-all or a magical exercise, which people are always asking me for. What's the best exercise for this? Well, it depends on the person, and your only way to know that is to sort of do a lot of assessments. So always sort of keep that in the back of your mind. Next thing is sort of never assume. So especially with back pain, or probably with any injury, but back pain can be really confusing at times because the pain can be in the same spot but for the complete opposite reason. So assuming that you're going to treat them all the same. So most of the cases I would see are flexion related, and they're the ones that end up with bulging discs. So that's when a person bends over, as the guy's showing you here, and then all of a sudden you get that grabbing feeling in your back there, and it's excruciating. It can, even partial paralysis, and creates sciatica, all that sort of stuff. The lesser known one, and probably not as severe, well, at first it's not anyway, but is the extension related one, and that's where people are sort of standing in that upright posture, and just standing even is like a painful. Standing, walking can be very painful for that person. They actually feel relief when they bend over, as in the case of this guy here. When they bend over and stretch it out, it actually gives them a bit of relief. But as I'm going to show you, that temporary relief is actually not a good strategy. So this is where, you say this a lot with food as well. One man's cure is another man's poison. So sometimes foods are really good for some people, but then they create opposite problems for someone else. Same with diets. But in the case of the exercise of choice for when someone's got a bulging disc, especially when it's really, really symptomatic and they've got extreme pain, lying prone, like as shown here with Nathan, relieves the discs and sort of lets the gravity sort of pull it away from the spine, from the sciatic nerve, and can be very relieving. However, with the SIJ person, that actually just puts them more into the position of what was causing the problem, which is his extension itself. So this is where, like this, where you can sort of see the pain's in the same area, but it can really aggravate things. So first thing before we sort of tell you what to do, is understand what the SIJ is. Where is it? And more to the point, what's its purpose? So what's it there for? What is its main responsibility? Well, its main responsibility is to transfer the weight of the upper body to the lower limbs, and you can sort of see in this picture here where it's positioned here, and it's quite a unique joint. It really sort of gets easily crushed. That's probably where because it's a very, very strong joint. So because it's meant to support the entire weight of your upper body, so therefore you'd want it to be very strong. But unfortunately, it sort of gets easily sort of compressed when the muscles supporting it and postural and movement things around it expose it to more compression. So you basically have two sacroiliac joints, one on the left, one on the right, and they often match each other. Like everything that's a left and a right, you want it to be symmetrical. When it's asymmetrical, you have a lot of problems. So the stability is maintained mainly through a combination of bone structure, but very strong ligament structure. So the best way to sort of think of it is like a shock absorber, just like a suspension in the car or something like that. So it's to basically trying to cushion the stress placed upon the lumbar spine and the disc. That's where its main purpose is to do that. So with the cases of extension being the trigger, as we mentioned at the beginning, this is where people sort of actually move too much into it, and then it just begins to compress heavily into the structure, and the ligaments that are supposed to, and the muscles around it that are supposed to support it, are not able to do so, or perhaps they weren't doing it, which is exposing you to the compression. So So the movements that promote extension to relieve pressure on the disc and sciatic nerve will do the exact opposite for extension, where there's more stress being placed into it. Hence, that's why walking, standing can be very painful. And this is a typical sort of thing I would see with a person who's standing and feels this pain. And funnily enough, they actually tend to move into their pain, just like the flexion person does. We often see that as well. So big key to the problem is the dysfunction around the glute maximus. Not so much the medius. The medius will actually tend to overwork and create even more compression and further weaken the glute max. The glute max is the key. The posterior sling is also very dysfunctional, because you actually can see issues that are start to show themselves in the shoulder when we see issues like this, because the whole body almost sort of moves into a scoliosis, but it's not really a scoliosis, just like a lateral shift. So the posterior sling, if you haven't seen other videos of this before, make sure you check the description below this video, by the way, because there's heaps of articles and things that I've put with additional information on things I might leave out in this video, because I'm sort of skipping through it quickly. But posterior sling, as you can see here, is sort of the glute max on the left side working with the lats on the opposite side, and working right through this right arm and left leg and vice versa. Alright, so that's basically the action of this is to prevent rotation of the pelvis when we walk, to create an efficient movement, and sort of supporting the spine in a neutral position and the pelvis. So weakness there leads to compensation. So if a person has developed significant weakness with the glute max and the posterior sling, the body's forced to find another way, so that they will be unable to generate the necessary hip extension to complete the gait cycle. So the hip extension is when this leg is kicking out behind you. So instead of this leg kicking out behind you and remaining upright, basically they're trying to get their extension almost from their back extensors. They're almost trying to like lean themselves backward to move forward, and just by constantly doing that places huge amount of pressure into the SI joint, sacroiliac joint, and just with like anything that does that over and over, you start to create lots of long-term problems. So it's basically a reverse method of hip extension. Instead of coming from the hip, it's coming from the lower back. So to assist in the process, body also increases activity in the contralateral latissimus dorsi with the hamstrings to assist with the stabilization of the leg during the single length leg stance. So this is one reason why people have tight hamstrings. All of the compensations lead to more force being applied into the lumbar spine. This is just being constantly compressed in extension all the time. Like was mentioned a second ago, over time, with this constant crushing of it, just leads to eventual pain. The hamstring, by the way, is no matter how much you stretch them, they're always going to be very stiff. This is where we sort of see people that on a lying down hamstring examination, they look quite good, but when they stand, they just have incredible stiffness. And this is a bit of the taut versus tight sort of thing. So in this case, the hamstring stiffness is a necessary stiffness to prevent extra crushing of the spine as such. So it's actually it's picking up the workload of the glutes. So trying to mobilize the hamstrings is pointless, because you actually need it, even though it's dysfunctional. It's the real secret is to addressing that problems with the glute max. So the force of the SAJ is even greater during certain movements where the hip and the pelvis subject to even greater load. So example here would be walking upstairs, and especially taking two at a time, and hence the person who has this is going to feel extreme pressure doing that. So even in the gym, step ups, lunges, even with similar sort of hip flexion movement in a big wide stance, a person just can't control the extension, and they're basically going to be forcing themselves up by using their lower back. And you can imagine, if you can understand that about 2.5 times your body weight is placed onto that single leg when you're walking, and it's a bit even more when you're running and jumping even, you can imagine just how much stress is going through there. If they can't derive it from their glute max, they're going to overwork the glute med and really work through the extensors to take up the work of the glute max, which is the largest muscle you have in your body. All right, so just to give you an idea of how strong that is. So What causes it to be unstable? Well, it could be many things, and in many videos I've said this over and over. Lack of movement, so simply just not doing enough, inactivity, poor movement and poor coordination, and obviously the glute max. So poor coordination, just unaware of the fact that you just don't move well, never paid attention, never even knew what good movement was. So in this case, the third factor being the glute max could maybe even contribute to the poor movement. It's hard to say which one caused one. It's a bit of the chicken and the egg, but basically, you know, all of these are potential factors as to why it began and why it happened. So the thing with the glute max, before you just go and start crushing it with heaps of exercise, you've got to understand it's sort of very prone to weakness. So it's because of that, it's sort of easy for compensation for other areas like the glute med we spoke about a few times already to steal its work. So the inactivity is a big problem because it leads to atrophy, and it just exposes you to instability the longer you sort of remain inactive. So the body's just forced to find another way, and it'll just use stiffness, and the hamstring thing that we spoke about already will be a necessary stiffness to pick up the workload of the weakened glutes. All right, so this is an example of the posture that we would also see that's typical, where where everything on the lower back is getting crushed. The hamstrings are actually quite taut here, so they're actually being overly stretched, but they're going to develop huge stiffness here because that glute's going to be pretty inactive if you're not moving well. This posture, by the way, may not always be problematic. I actually would prefer this than the flat back. I see a lot of people trying to change this way too much. If there's no pain with it, I'm not really probably going to go and change it as quickly as I would if I see a flat back person with no symptoms. All right, so we'll touch on this a bit later in the video here. But poor movement. This is an example where we see the SIJ being and muscle imbalances just from moving poorly, so just poor coordination of movement. So these two videos here are pictures of squats where they're just poor form and basically really not getting enough, in this case getting absolutely zero from the ankle and the quadriceps. All the load is eventually going to go into the back. The back's going to learn that it's going to have to overextend itself to get out of the squat because it's not coming from the legs. This position here is actually good as if it's a deadlift, but it's no good if it's a squat. All right, and we sort of want that. You can sort of see the positions here that we want, and so dropping down and very much the same thing, but it's sort of a little bit different. Bulging disc injuries as well. So this is where, you know, overextending these over-mobilizing. So this is a hypermobile person. Obviously, not many people would do this, and you know, and these sort of things are terrible. This is where I see a lot of problems come from yoga. Not that there's anything wrong with yoga if it's done intelligently. It's great because a lot of people come and attack me when I say this, but I see a lot of problems coming from yoga and a lot of it from overextension and overflexion. So just understand that when you do any of these things, these sort of constantly moving in this way, you end up creating coordination and neural problems that end up shutting down muscles like the glute max. A deadlift is an excellent way to build strength, but not when it's done like this. So this is obviously poor. This is a great way to get a bulging disc. And the second part, which is say she did pick it up correctly, but then did this at the top, this is also going to create huge problems. So this is where we see a lot of hip impingement problems, poor tracking, and again it's going to shut down the glutes. So great exercise for the glutes, but when it's taught poorly or just done poorly, it's going to backfire and it's going to actually do the reverse. This is poor coordination that we've covered many times with ACL problems and valgus, and it's partly where the foot is involved, and we see this a lot in single leg stance. Again, poor hip control, poor glute max function. So this is sort of a same muscle weakness, but completely different patterns of movement, a different type of role that the glute's playing. This is a bit of extension, and this is when it's trying to control single leg stance. In both cases, you will see the same weakness. So the lordosis and anterior pelvic tilt. So as I touched on before, extension-related pain is often associated with the excessive lordosis and excessive tilt. And this is where you can sort of see this in the plank here, where you see this almost like little divots in the spine here, where they just poor control and they're really just loading up through the thoracic extensor here, getting no control through the abdominal and lumbar position, and just a poor position to be in. All right, so this is where we'll often hear the lower cross syndrome that Yanda's made famous. So where we see the glute max is weak with the lower abdominals and the tight thoracolumbar extensors with tight hip flexors. I sort of agree with some of it, but not always, because I sometimes don't see this all the time, and maybe not that to that degree, and actually trying to correct it just by doing strengthening like this won't really get you that far. So stretching the lower back, this is where people with that extension they actually feel instinctively to do this, and they feel a short-term relief from doing it, and they end up doing it all the time. This is not a good thing to do. You actually need to not do this at all, because this temporary relief is just reducing the pain sensitivity in the nerves, but it's really setting you up for long-term problems. The area they feel the pain is where they're trying to stretch it out, but while it sort of seems to make sense to do this, all it's doing is really making your lumbar spine even more unstable and more vulnerable to more pain, and eventually you probably will get a lower back disc bulge from this. So you actually learn to need to keep stiffness in this area and not keep flexing it like so. And also there's a chance of hip impingement. So this leads us to the next part, where you're actually then trying to stabilize it, and this is where we see people trying to use the posterior tilt. So the posterior tilt is not a good thing, a good strategy at all. I would not recommend, and this is when I see this used a lot in Pilates and they call it imprint. I would definitely not advise anyone to ever do that at all. I would just try to tell you to keep your pelvis in neutral. Neutral is the best place to be. Anterior tilt is not always a bad thing, and you understand that if you ever watch any elite sprinters, especially the 100, maybe even the 200 meters, you will notice nearly every single one of them has extreme lordosis, and that is for a specific reason, that they need that anterior tilt to create the strength through the glute max to make them an elite sprinter. Without that position, you will not see a flat back, a posterior tilted sprinter. You just will not find one, because they just do not have the strength for it. You may see it in distance running, but in sprinting you will not see it. Alright, so, and then they don't have extension related back pain. Maybe some of them do, but it's not extreme problematic as you see in the everyday population, because they have extreme strength, they can control it. So that's an indication of where you can be in this posture and be perfectly fine. Alright, so the key is to learn how to hold the pelvis in neutral, because it sends the foundation of things to come. So a great little quote: best place for lumbar spine to function, be safe from damage, is when it remains in neutral, and that's a quote from Stuart McGill. So if that's the case, you would want to see neutral spine used in nearly every exercise. So I can't think of a single thing where I wouldn't want it to be in neutral. I could think of squats, deadlifts, push-ups, chin-ups, lunges, even running and walking. In every single case, I don't want to be in flexion, and I don't want to be in excessive extension. I just want to be neutral. So that's a perfect example of just why we want to be like that. That's the most efficient way to be. So these are all examples of being flexion intolerant. So this is overstretching it, this is poor control and poor control. Every single one of these is going to lead to back pain. All it needs is a bit of time. Alright, so the spine doesn't want to be bent, it just wants to be held still, and you should be in all three of these. You're not getting any movement from the hips. You're getting a small amount there and a small amount there. You're getting zero here. You're getting all of the movement from the spine, and if every time you keep bending it, you're going to, whether it's extension or flexion, you're going to have trouble. So leading to the strengthening of the glute max, this is where you've got to be very careful of how you do it, because if you start to use butt gripping, where you're excessively squeezing and trying to push it through, as you can see in the deadlift here and in the hip extension here, in both cases it's excessive gripping. This is going to lead to piriformis problems and definitely hip impingements. So the exercise that was actually going to help you is now going to reverse again, and it's going to backfire on you. So to effectively strengthen the glutes, you need to have exercise that does stabilization of the hip, acts as a hip rotator, and also tries to lock the head of the femur into the socket, creating tight and stable hip joint. That's what sort of stops it from rattling around when you're walking and running, and eventually stops the compression into the SI joint. So So the strength is of no importance if it does not relate to a movement pattern. The timing's more important. So what exercise should you use and where do you start? Well, single leg ones are great, but they're too difficult to get to straight away. And even this one's poor form because he moves into lumbar flexion. It would be much better with his leg behind him in extension as we would when we walk. But a single leg exercise is a great way to do that, and we'll show you in a minute. Before you get straight to that, you start with the easy ones. So you start with learning how to breathe and create basic pelvic stability. So before I do any deadlift single leg work, I'll spend considerable time doing that. Again, check the description underneath the video because I'll have articles that go into more detail. Strengthening's no use to you if your stability is compromised. So you've got to learn with the basics first, all right, and then work your way up. So creating inner unit function, learning how to do this, develop the slings in the floor and kneeling positions before the standing ones, getting timing, forward ball rolls and things like that. A jackknife is an excellent one. Again, it's in a horizontal position. These horizontal ones are great for SIJ problems because it helps you to lengthen the spine without the compression. So whenever pain's at its worst, I'll always move to horizontal loading away from vertical loading of standing deadlifts and single leg squats and stuff like that. This exercise is much more than just an abdominal exercise because it's actually teaching you how to control hip flexion and guide that head of the femur into the hip socket correctly. So, and while at the same time forcing you to maintain your lumbar stability. So for that reason it's superior to the plank, for it has a similar timing movement that we would use when we walk and run. Stretching is still okay, but and it's still, and without it can be a good thing, but if it's not used well, it can really backfire on you. So I prefer my floor-based exercises, and the horse dance one here is probably my favorite. And it's again, it's a great one to use because it reduces that compression and it really gets the glute max going massively because you can really target it without the glute med coming in and without the complexity of foot things getting in the way as well. So you really get a lot out of this movement by even attaching a cable or a resistance band to the foot when you're moving it. All right, so generates huge amount of glute max control. Here's a video here, and there's a video on the YouTube channel of where we've attached the cable to this, and I've done this one a few times before, but this really works so well just because there's no compression into the spine because you're horizontal loaded. All right, so single leg hip extension, there's a great little test I like to use. This one sort of shows any lateral deviation, and it's the test actually becomes an exercise itself, and it really shows how important it is to create the breathing and the contralateral oblique and the TVA to work in tandem with the glute that's on the ground. So in this case, the right glute working through the left oblique and the TVA, they have to work together. And when you place a stick on someone with a partner doing it with you, it really works quite well. Once you've got the hang of it, obviously, then you can move into the more demanding exercise as such. But if you just went straight to this without that, you may end up just again developing things in the wrong area and overdeveloping the glute med and going into your lower back again. So start with the simple and work your way up. The deadlift is where you start to get the standing. The Romanian deadlift is the big one. It's where you're really learning to use the hips for the first time and also controlling that lumbar spine so it doesn't move out of neutral at all. This is by far the best way to develop the glute max when you're in the standing position, but again it has a lot to do with how you do it. If you don't get it right, it'll backfire on you again. So learning how to brace correctly, as in these videos, these are all videos that are on my channel, you can go and check them out. So in some cases I see people coming in to me and they say, I've got this SIJ pain, I've been doing deadlifts, so they've been doing the right exercise but their technique was all the problem. So they were actually trying to lift the bar up using their back extensors and not getting the feeling of pushing away with the legs. So there may even appear from watching them do it that they're doing it right, but their technique's all wrong on the inside. So it takes a bit of careful coaching to get around that, and you really have to break things down with the bracing strategy that they're using and really help them coach through that. So this is a great exercise, but done poorly it won't work for you so well. Over squeezing the glutes, which we touched on about before, you really got to be careful of that, because if you do that, it will sort of affect your ability to center the head of the femur within the hip socket. And this is a picture of what that looks like. So the basically the head of the femur starts to migrate forward, and that's when you get that pinching feeling at the front of the hip, and that's where you think you've got tight hips, when you haven't got tight hips at all. You've just got poor centration of the femur because you've got a weak sort of glute and you've got poor movement function. All right, so this is a good sort of an example of what that looks like when you're sort of doing this stuff over and over. That's exactly what's going to happen to you. Integrating with the posterior sling. So once you've sort of got the basic deadlift, then you want to sort of move into the single leg stuff, and also combining it with the upper body, as we touched on before a bit earlier on. So this, remember, the SIJ's purpose is to transfer the weight of the upper body to the lower limbs. So it's very important to start combining the upper body with the lower legs to make sure that the timing is correct, because you may have the strength in the glute max when it's working by itself, but when it integrates it just dysfunctions, because that's what you've always done. All right, so the single leg stance is so much more difficult, but it has so much more benefit to you if you can get it right. So I like to sort of gradually progress from sort of basic stability, like a toe touch drill, to then to the single leg deadlift, to then to a step up that's a bit more explosive, a lot more control, a lot more load, as we spoke about before. So always start with simple and work your way up. Remember, in all of them you've got to be in neutral. Don't want to be out of neutral in any one of them. All right, and really learn to push the ground away, not try to come up by extending your back. All right, so in the single leg stance, I'll look for a few things as well. So from front on, I'll look for alignment of the legs. That's a dead giveaway if I'm losing hip control or even foot control. Postural alignment, again, this will indicate if I'm trying to use my lower back to get my extension, or if I'm deriving it from my glutes. Poor range of motion, that's where like lack of mobility might be a problem. Maybe hiding weakness, or maybe it's just stiffness has been there so long that you're really going to have to work on that first. So the exercise itself becomes a great test. You can sort of see here all the different things that are going on in just this one movement. And I'm really learning to control lateral sling here as much as the posterior sling. Now, once you've got through all your exercise program into play, you can't ignore daily movement. So you've got to pay attention to the way you sit, the way you walk, how you sleep, how you stand, bending, and that everything that you do during the day. If you're going to go and do your exercise program and then sit on the couch like this and work on your laptop for 3 or 4 hours, it's going to undo everything you've just done. You've really got to apply everything you've learned into the postures that you have throughout the day. If you do that, your success of your program will be significantly faster. All right, because it's sort of the hidden trigger. All right, so just because it doesn't hurt at the time doesn't mean it's not doing damage to you. All right, so really got to identify these poor movements and change them. So in summary, there's no doubt that SIJ can be very painful, can disrupt everything. Resting and using anti-inflammatory medication is not going to really do anything for you, which is what most people do at the beginning. Stretching can help to some degree, but if you're going to try and stretch out your back with some of those stretches I'll show you, that's just going to make things significantly worse for you. You could stretch through the hips and that, but that won't address the weakness of the glutes and the abdominals, but particularly the glute max. That's really the big problem. And just strengthening the glute max won't do anything if you don't identify your poor movements and change them. So if you do everything that we're showing you in this video, you'll start to become a long way. Again, check the description underneath, because there's tons of stuff I left out, because this video would just go for 2 hours if I left it all in there. All right, so if you have problems with back pain and that, there's a great video program that you can download from my website. Again, it's in the description. There's also heaps of free reports, and you'll find all that under the video here. All right, so if you have any questions, comments, leave them on the channel and I'll get back to you. All right, thanks for watching, and I'll see you next time.